Member for Chilliwack-Kent.
Good morning, Honourable Speaker. Thank you. I think that perhaps one of the most misleading ideas about feminism and gender equality is that if you can look around and see more women, we must be achieving it. Take this chamber, for example. There are more female members than ever before. If you can count an equal-ish number, that must mean equity and equality, right? That, to me, is a most dangerous notion. A notion that, if taken without any critical examination, could have us ignoring many gender-related inequities that put us all, men and women, at risk. One of these inequities, perhaps one of the riskiest in my opinion, is gendered health. We all know that our healthcare system access is for everyone. When we talk about health, it doesn't matter your gender. Access is open to everyone, but access to what? Healthcare is based on a very long and old tradition of predominantly men studying in predominantly male discipline, doing research about and on predominantly male bodies, for the purposes of keeping society healthy. And traditionally, society has had a very narrow definition. Spoiler alert, it's men. Now, we have moved past this. We have brilliant people in STEAM working in medicine and research and treatment, and it's different today. We have men and women engaged in the work required to have the science required to do the science and be representative, accessible, and relevant to all genders. But we can't ignore the hangover of our history. We know that all genders can experience access issues and health, and it is critical to not lose sight of this. Today, I would like to discuss about gendered health for women. Let me give you an example, a very simple example. Take the heart attack. We all know the signs and symptoms, right? I think I learned them in grade 6 or 7, probably while doing jump rope for heart. I think many of us may have. The symptoms of a heart attack are squeezing chest pressure or pain, jaw, neck, or back pain, nausea or vomiting, shortness of breath. But it is a fact that women die every year of heart attacks because these are actually the symptoms of a heart attack for men. According to the Heart and Stroke Foundation of Canada, for women, symptoms are chest pain, but not always, pain or pressure in the lower chest or upper abdomen, sweating, jaw, neck, or upper back pain, nausea or vomiting, shortness of breath, fainting, indigestion, and extreme fatigue. Some symptoms are the same or similar, but many are unique. So unique, in fact, that most women have not heard of these symptoms being associated with heart attacks and so brush them off. Last night, when I shared this with my partner, he was surprised and said he had no idea. This wasn't a shock, but his next point was, how do I know how to help you that you even need my help if I don't know this? It's not just women who need to understand and know the signs and symptoms, but those around them who love and care for them, employers, friends, all of us. How do we take care of each other if we only know the signs for approximately half of us? That's just one example of how research and education can be gendered and can impact health outcomes in women's bodies. Women's bodies are often smaller, with smaller hearts and arteries, and there are specific risks that we know impact women's health. Risk factors like pregnancy, menopause, and hormonal changes that impact every system in the body and can result in drastic changes, as well as gender-related factors such as lower socioeconomic status, gender-related violence, and the reality that there are still many arenas in our society where women's experiences are just not believed. We also know that many of these risk factors are exacerbated for our trans brothers and sisters and for racialized women. So there are some very real risks to gendered health, and there are also some very real costs, both individual and social. Social costs are both more difficult to initially recognize and dramatically more costly and risky to our province. One very big example is the cost of caregiving. Women continue to overwhelmingly provide most of the care. In our personal lives, women continue to leave, adjust, or limit their participation in the community and economy in order to carry the weight of caring for our babies, our children, aging parents, sick partners, or family. Even before the pandemic, 30% of women in BC support people who have long-term illnesses, disabilities, who are aging, and racking up an estimated total of 6 million collective unpaid caregiving hours per week. Professionally, women continue to make up a huge majority of care aides, community support workers, residential support workers, nurses, long-term care, healthcare workers, childcare providers, mental health workers, nutritional and cleaning support professionals, and education staff. These positions require a massive amount of emotional labor, which I would argue is essential, but often unpaid, and traditionally, they're largely precarious positions or underpaid. The BC Women's Health Foundation has indicated in their Unmasking Gender Inequity report that historically, girls and young women have been encouraged into occupations with high levels of flexibility under the assumption that they will eventually be the primary caregivers of children and other family members. According to the report published by the Foundation, the concentration of employment in these sectors led to women in BC losing 60% more jobs than men, as women occupy jobs in industries that were the first to be impacted by job loss or restrictions, that those jobs were impacted to a greater extent and for a longer period. The same report found that the gendered nature of work put women at higher risk of exposure to and infection from COVID-19 in BC. Women having access to health care that is relevant and inclusive to them is more than just a moral or social responsibility. As the report highlighted, children, families, and communities need healthy women. Essential services need healthy women. Organizations and the economy need healthy women. And if there are still any who need more reason, making changes that support women staying healthy has the potential to save up to $2.6 billion in lost worker productivity annually in BC, and as much as $17.9 billion across Canada. Thank you.